Welcome to another edition of Real Men Wear Gowns. This is our year-long series to encourage guys to get that scan, get that checkup, take our health seriously. And today we're digging into a condition that affects nearly 1 in 5 Americans. GERD, short for gastroesophageal reflux disease. You may know it better as chronic acid reflux. And if it's left untreated, GERD can lead to serious complications. Dr. Paul Haynes from Indianapolis Gastroenterology and Hepatology is here to tell us what we need to know. Thank you very much for being here.
Thank you, Dustin, for having us.
So that burning sensation in our chest, especially after meals, maybe when we're lying down, what is that and how does it happen?
Yeah, we call that acid reflux. People experience heartburn, kind of a burning sensation in the chest. Sometimes they get a little bit of regurgitation or food contents or sourness coming up into their mouth, back of their throat. They can get a sense of nausea, a sense of chest discomfort, typically a burning discomfort. It happens when food contents, typically acid, comes up from the stomach into the esophagus.
And there are over-the-counter medications we can take for this, but how do you know when it might be time to see a doctor about it?
Right. Typically, we talk about when patients are having symptoms more than 2 or 3 times a week, when they're starting to interfere with their quality of life, when they feel like it's, impeding things that they typically would enjoy, impeding meals, impeding their ability to, stay focused at work, keeping them up at night, interfering with sleep.
What can we do to prevent this?
Not smoking, keeping your weight down, staying active, and then there's some dietary measures we can all take in terms of, not eating late at night, limiting alcohol, carbonated beverages.
Okay. What about eating quickly? Is that a myth that the faster one eats, the more likely they are to have acid reflux?
Well, there's a little bit of truth to that. So when we eat, our stomach should relax. We call that accommodation. So the stomach should relax in preparation and in receiving the meal. If we eat quickly, just kind of gobble down that cheeseburger, the stomach hasn't really had time to accommodate, and so that can lead to some more troubles with acid reflux.
Okay. What's your final message to viewers who are watching who may be hesitant to go to see you if they're developing these symptoms and experiencing them pretty regularly?
Yeah, I mean, I think this condition is more common in men than women. It's more common in older patients than younger patients. And if you're starting to develop what we call alarm symptoms, it's really time to start talking to your doctor. Those are symptoms of pain or difficulty with swallowing, ongoing upper abdominal pain, if you've seen blood in your stool, or if you've vomited blood, or if you're having, unexplained weight loss, it's time to really, have a conversation with your doctor.
Okay. Well, we have much more to talk about. You can catch our extended conversation online at WTHR.com/realmenweargowns. Dr. Haynes, thanks so much for joining us. Really appreciate your time.
Yeah, absolutely. Thank you.
All right, let's switch gears here, get into weather. Overall, pretty quiet.